and young adults. Thank you, Hazel. Between the ages of 10 and 34, and among Alaska Native young people aged 15 to 24, it is the leading cause of death. However, not all AIA and communities experience the same challenges with suicide. Rates can vary considerably from among communities, even within the same region. While the causes for this variation are poorly understood, suggested explanations for resilience in certain individuals and communities include meaningful community control and self-governance, social connection, and access to and participation in cultural practices and spirituality. The National Institute of Mental Health, with co-funding from the National Institute on Minority Health and Health Disparities, established the collaborative hubs to reduce the burden of suicide among American Indian and Alaska Native youth, to conduct research focused on reducing the burden of suicide and promoting resilience among AIAN youth. In 2017, this program funded 3 collaborative research hubs, one of which is with us today, to increase the reach of and research based on effective, culturally relevant preventive interventions that will increase resilience and reduce suicide in rural and urban Indigenous communities. Today, we have the pleasure of being joined by Yvonne Peters, Katie Cuerva, and Jim Allen. They represent and lead the Alaska Native Collaborative Hub for Research on Resilience, or ANCHRR, that anchors and supports collective efforts to reduce the burden of suicide among Alaska Native youth. The Hub uses scientific tools and methods to document and build AN's strength and protective efforts against suicidal and other adverse behaviors through studies of multi-level model of youth resilience. The Hub also develops and sustains tribal capacity to direct and conduct research and use science to promote and increase well-being among Alaska Native youth and communities. To start us off this morning, please join me in welcoming Yvonne Peters. Yvonne.
Great. It looks like, Jim, you're controlling our PowerPoint and you want to get it into a presentation view. Can we do that? Oh, it's a...
If you hit the in the upper left, that green, we'll put it into full screen, usually. That little green circle. Further left, further left. Yeah, that.
There we go. All right, great. Well, thank you all for joining us this morning or afternoon, wherever you might be. As I mentioned earlier, my name's Yvonne Peters, originally from Arctic Village. I'm Netsagwichin and Koyukon, and really just coming into this work, it's good to see a few familiar faces that I've collaborated with or got to know over the years doing this work on suicide prevention. As an Alaska Native male myself, growing up within both our villages, but also spending some years in an urban environment, at an early age, my teenage years, really struggled like a lot of our young people. And coming out of that period of time in my life, really focused on this question around why is it that there's so many challenges? My screen stopped sharing. Is other people seeing a blank screen now as well?
Yeah, I am.
Yes.
Yes.
Okay, there we go. Okay. And what I was saying is that coming through those personal experiences of really wanting to understand why I had experienced so much struggle as a young person, and also asking some deeper societal questions around why was it that most of the Alaska Native people that come out of our villages and communities live in the impoverished portions of our urban areas, while it seemed like all of the other ethnicities and people from different backgrounds, aside from some African-American people who are also in our communities, why was there so much impoverishment within our community and social and other challenges that we were facing? And so that kind of launched me on my life trajectory, which landed in some of this work around healing, wellness, and self-determination. and specifically focusing in on suicide prevention, beginning with some work that I collaborated on in the Northwest Arctic, as well as in the Bering Straits with Dr. Lisa Wexler, who's one of our leadership team members for the Alaska Native Collaborative Hub for Research on Resilience. And to that extent, I do want to emphasize that with the Alaska Native Collaborative Hub on Research for Research on Resilience, our leadership team that you'll meet Jim here in a bit with his part of the presentation, as well as Dr. Stacy Rasmus and Lisa Wexler and I, when we came together to begin to initially establish and move forward some of the thinking that underpins and is at the foundation of this project, we came together with decades of experience doing work in the field, having built established relationships at a community level. And that really provided a strong foundation for us to move quite rapidly in the way that we're able to structure and build out the collaborative hub itself. And so I think that's a really important point to raise, because we have been asked in other presentations by other researchers, how do we move forward with this depth of partnership within, in this case, the Alaska Native community? And it really came out of not only those that I mentioned, but others you'll see here listed on our leadership team, including Drs. Jessica Black, Carol Murphy, also not listed is Dr. Charlene Opuk, and others. Both came from within the Alaskan community, but also came with quite a bit of experience and relationships. That was enabled us to be able to really move forward quickly from that foundation. The Collaborative Hub also, was an effort where we were thinking about multiple factors that we wanted to help affect change within while we were conducting the research project itself. And so I'll get to it in a second, the different levels of engagement within the Alaska Native community that we established, but we wanted it to be grounded through an Indigenous worldview and lens. And so kind of grounding our work with ceremony. And you'll see in this opening slide there in the lower left, Elder Luke Titus of the Danat people, who are of the land that I live on now, from Minto, who is drumming us into our initial Collaborative Hub meeting, where we were bringing together Alaska Native community members from across the state who shared our interest and desire to want to reduce and prevent suicide within the Alaska Native community, and to share some of their knowledge, thinking, understanding, and experience as well, because there are a lot of our people who've been doing this work at a community level who wouldn't refer to themselves as scientists per se, and maybe not even as people focused on behavioral health, but who are concerned and actively engaging at a community level with different interventions that were largely culturally based. And so we opened up our initial Collaborative Hub and the work that we're doing with ceremony, because we were really perceiving this work as being grounded in that context. The other couple pieces that I'll just highlight here are, we're also very interested in looking at the way in which at a research university level, in our case, the partnership between our three universities, but housed where I'm housed at the University of Alaska Fairbanks, really looking at how can we conduct and carry forward research in a way that has authentic and meaningful partnership with the Alaska Native community at multiple levels, where they're really helping to guide and inform and shape the way that we're moving forward in each step of conducting research and working towards outcomes that will be a benefit within the community. And simultaneously, in the way that we're conducting the research project, providing benefit to the community as we move forward. And to that point, I want to emphasize that building capacity within the Alaska Native community was a real high priority for us from this time of inception in moving the project forward. And we did that at multiple levels that I'll get to here on the next slide. Now, you want to forward to the next slide, Jim?
I sure will. Just give me a second, Yvonne. I realize this is an older version of the presentation. I'm going to pop up the correct version. So I'm going to take us off sharing just for a moment, close this out and get the correct one up. Okay, is that visible now?
It is. It's just not blown up to presentation mode yet.
Okay.
So the collaborative hub itself, as I mentioned, we're very interested. I'm going to just talk while you get it pulled up, Jim.
Okay.
Um, as I mentioned, we're very interested in having Alaska Native direction, engagement, and capacity building throughout the project. And these are three areas that I'll speak to on this. One is at our executive advisory committee level, where we felt it was really important for us to be receiving guidance at the highest level from knowledgeable Alaska Native and experienced Alaska Native leaders from across the state. And so our EAC is comprised of leaders that are serving at the helms of health organizations or hospitals and clinics, tribal regional organizations, some tribal for-profit corporations, village-based leadership positions that were held, and people that are also at high levels within the state system, because we felt that it was really important for us to be being held accountable at the highest level to leaders who are in this realm of engaging at a high level in leadership within and across the Alaska Native community. There we go. And so the EAC has been really critical in providing that guidance and feedback to us. Multiple times over the course of our project, they've said, wait a minute, you need to think about this and this. And while it's been a challenge for us, we've slowed down our process multiple times to take a closer look at what they elevated to us as a concern or something that they felt was an important step for us to take in order to follow tribal protocols in the way that we were moving forward and conducting the work. And so we took the time to do that, which I know is challenging oftentimes for researchers who are wanting to just expedite the process of getting a research project done. But I think that that's also an important point that I wanted to highlight, is that it's really important, I think, for us when we're having this level of engagement within Indigenous communities to really acclimate to the time and schedules within those communities, because as you all are probably aware, a lot of times within small, especially small and remote Indigenous communities, people wear many hats and are navigating so many different leadership responsibilities that making those adjustments, I think, are really important. The Research Steering Committee is made up of individuals from the three regions where our ANCHRR's research study is being conducted. And that Research Steering Committee is made up of folks within the tribal healthcare system, community level leaders, and a mix of both Alaska Native people from within those communities and then others that are staff in those organizations. And the Research Steering Committee has really been more intensive and hands-on than our EAC in helping us to, for example, shape our survey questions, do runs of them, and provide us input and guidance as we move forward with the project. And so they're much more hands-on than the EAC. And finally, I alluded to earlier, the Statewide Collaborative Hub, where we're pulling together kind of this larger group of Alaska Native leaders from across the state to help inform and shape what it is that we're looking at, and also give us feedback on sets of questions or groupings and topics that we felt were really important for us to study as we were shaping the study itself in our first specific aim. Next slide, Jim. So there's two components to ANCHRR. One is that collaborative hub, that broader engagement within the community. The study itself is the ANCHRR study. Here are listed out the three aims within our study. We've completed the research, which I'll get to, the data collection, I should say, on aim 1, which was really taking a look at community level protective factors. And so for so much of the research in a historic context, the focus was on individuals and what was happening with individuals and how can we provide behavioral health interventions to provide support at an individual level. But we were very interested in looking at community level protective factors, largely because within the Indigenous communities, we exist at a community level and scale in the way that we're engaged and have association with one another. And so the emphasis there for us in that specific aim 1 was to build off of some other research that had been conducted in other areas around community level protective factors and to kind of deepen that in the context of the Alaska Native community. Specific aim 2 is then for us to take that protective community scale, which I'll get to in a second, which come out of specific aim 1, and then to further test that within communities on looking at, do these protective community level factors have an impact, and what impact do they have on an individual level within those communities. And Jim will get more into detail on specific aim 2 in a future slide. And then finally, to develop some tools and mechanisms for us to share the outcomes of this research, which we believe will really help to shine a light in and be a resource for Alaska Native communities to look at how they can strengthen protective factors within their communities for their people, and in particular for young people. Next slide, Jim. So this is the Rural Alaska Native Community Resource Protections from Suicide slide. I'm not going to walk through the entire slide itself, but this is really the model that we're assessing with our specific aim 1 research. You'll see on furthest to your left there, there's actually, can you blow it up a little bit more? I'm visually impaired, so it's hard for me to see the slide. I don't know if it's hard for some others. I don't know if there's any way to make it a little bigger. Otherwise, I'm gonna have to go closer, but maybe I'll do this. Sorry for being so close to my camera for those who might be seeing my face up close or forehead.
I'm not sure there's any way to zoom in presenter mode. I think you'd have to take it out of presenter mode and then zoom in.
Yeah, it's fine. It's fine. So the protective community resources on the left there, you'll see that list of 7. These are major groupings that were shaped through our processes with the Collaborative Hub, the Research Steering Committee, and some of the initial work that we were doing in building up to collecting data for specific aim 1. And so you can kind of read through those lists. I'll just maybe highlight one of them, the continuing Indigenous ceremonies, which is number 4, was one of the factors that we were wanting to take a closer look at. And you see the correlating, how does the community resources work to protect youth? And I think on that one, it says something around ability for youth to access Indigenous ceremonies. And then ultimately, as you move to the right in this model, we're looking to assess whether these factors result in a reduction of suicide death within the community, and looking at the pool of correlating our data with state data and outcomes related to suicide deaths across the state within the 64 communities that we've conducted this research. And you see that we did a total of 251 interviews. One point that I want to highlight with the way that we conducted those interviews is we used village-based counselors who are also students in our Rural Human Services program within the university. And so we used undergrads who are largely non-traditional undergrads. So give you, these are folks that are largely between their 30s and 50s. So they're experienced adults who live within their villages, many who speak their language as a first language, who conducted the interviews within their communities. And we really believe that that increased the validity of the data that we're collecting through these interviews. In some circumstances, for example, elders were able to say, can we just do this interview in our language? And if our interviewer what had that language as a first language, they were able to switch over and conduct it in the language. And so I'm really excited about the fact that we were able to both build that capacity with those undergrad students in conducting the research interviews, but then also, I think, produced better results for us with our data collection on the specific aim 1. So move to the next slide, Jim. So then we're also taking that same model and applying it to a reduction in suicide attempts with additional data sets that were pulled from the state systems. And so we're excited about finding the results here of that data collection when we apply it to this model. And right now we're at the stage where we're needing to go through our tribal reviews to make sure that we have approval from the tribal entities that are within the regions that we're conducting the research study before we're able to begin sharing or publishing any of the results of this specific aim 1 based on these 2 models. So with that, I think we'll jump into specific aim 2 and have Jim talk a little bit about this next stage of the research project.
Thank you, Yvonne. And we are really excited about progressing. I should check. Can everyone hear my voice all right now? Am I transmitting?
Yes, sounds good.
Thank you. We're very excited about the ANCHRR results, and they have led us to really reformulate and expand the AIM2 approach, which is going to put in action one of the goals of ANCHRR, which is we describe as really redefining the narrative about suicide prevention from deficits to strengths. So this second aim, instead of studying suicide, will directly study protection from suicide and try to understand how these community strengths work to do this, particularly in those communities, Alaska Native communities that don't experience high levels of suicide currently. How are they doing that? What is behind their success? So we're going to take 64 of the AIM-1 communities, and we've selected 16, and this is just a flow of how our work in the next year, what it will look like in this flow chart. And we're going to select 16 communities, which we have selected on the basis of a distribution of scores on the questions from the protective community interview conducted in AIM-1. We also are going to aim for diversity in terms of geography, population, other attributes that surface and distinguish the communities, as well as establish research relationships on the team. This is really in response to COVID, and we're starting up research. These communities have a lot of things going on right now, and we want to be as least disruptive as possible in the research. So we also elevated communities where we could enter into the community and continue in existing relationships. And then finally, a research steering committee has been giving us detailed feedback from this larger list. We hope to recruit 9 communities. And there are really 2 strands to this work. It's truly a mixed models study where there will be quantitative data collection where adults will describe their community, and then young people will describe their individual experience in protection. Then in a subset of 3 highly protective communities, we're going to do qualitative data collection. This will include individual interviews, focus group discussions, and youth digital storytelling, which Dr. Katie Cueva will share with you a little later in the presentation. And I won't go into all the details of this, but it's here for you to read if you're interested later. This is essentially the model we're testing and how all the data pieces together. And you can see 3 columns. The first column is about direct protective factors or strengths on the community and the individual level. The community level will be assessed in those 9 communities by adults in the community. And then we'll then be looking at the individual level reporting of young people about how these protective factors are experienced in their lives among 450 young people. And so the adults will be reporting on the elements that Yvonne just recently described. The young people will look at individual protective factors within their own lives, within their family relationships, their perceptions of their community, and a really interesting concept about the awareness of their sense of connectedness, not just with each other, not just with their community, not just with their family, also with their natural environment, the world of nature outside the community. The next column talks about something NIH is very interested in, and we are as well, mechanisms, how these things work. And we'll be asking young people through digital stories to describe how these protective factors work in their own lives. how you know, and how they experience these. A second test will actually be quantitative. We originally proposed that community levels, individual level protection, signified by the A, community level protection signified by the B, the community level would moderate the individual level protection and would result in buffering protective factors that directly protect young people from suicide through reasons for life and through reasons for sobriety or reflective processes about alcohol. With the advent of Bayesian statistics, we are going to be able to actually test more subtle models of how this works, and we're really excited about that. But I also want to highlight, in addition to these stories, the qualitative interviewing and the focus group discussions will actually allow community members to talk to us about how these things are actually working in their community. Now with that, I'm going to turn it over to Katie, who will be able to profile the digital story effort, which we're very excited about and is a new part of the study we had not envisioned we were originally going to be able to do, but thanks to a supplemental award from the NIH, we're embarking on this as well. Katie, over to you.
Thanks, Jim. Thanks, Yvonne, for the introduction to the project as well. It's really an honor to be a part of this work. When I started my career, I actually taught high school for the nonprofit branch of my region's Alaska Native Corporation. So I had a lot of interactions with some amazing young people, a number of whom had significant challenges. And so I switched over into public health and research to attempt to address some of those challenges on a more systemic level. And I feel like this work is getting at some of those things of what makes things harder or easier for amazing young people to be able to succeed. And my understanding is that during the course of this work, a number of people with the project expressed an interest in having youth voices really share their own stories. And I had been involved in a number of projects with digital storytelling. So I was approached to help join this project and talk to young people about what their stories were and what their experiences were. COVID has put a bit of a damper on actually being able to go to communities and have these digital storytelling workshops, but we're getting there. And I'll tell you a little bit about that process. So we have, our plan is to recruit a youth steering committee and to have the young people as part of that steering committee nominate elder supporters, elders that can help to facilitate and support the discussions. And we're working in 3 different communities, one in each region. So 3 of those 16 that Jim previously mentioned. And those young people will be invited to not only share their stories or help guide the research on what that looks like as far as digital storytelling and sharing stories of young people in their communities, but also inform the project. So invite them to join the larger ANCHRR steering committee, kind of our larger governance of the project, in order for them to be able to share how they feel like this project might be working for them and what we could do differently to better incorporate their views. Then we plan to go to these communities to host digital storytelling workshops with youth. And we also want to be respectful and allow space for the youth steering committee to really help shape and guide what those workshops will look like and who will be present and what kinds of questions we'll be asking, although our end goal is to help test, to triangulate the results of the model that you saw earlier to see, well, what community level factors do youth really identify as important to their wellness, and how do they tell those stories about how those community level factors work in their own lives. To get at some of that, in addition to those stories, we'll conduct interviews with young people after the digital storytelling workshops to see what they thought of them now that those issues have been raised, to hear their reflections on them, and then compare those digital stories and interviews with the overall results to help put it all together. We're hoping to get some really good context from the young people on all of those community level factors, or at least some of them, and going into more depth. Jim, can we go to the next slide, please? A secondary aim of this supplemental project is to learn about the effectiveness of disseminating this research, so disseminating the overall project findings through digital stories. So we're hoping that young people will give us permission to share their stories so we can use them when the research results are disseminated, and then ask the community members that listen to these stories what they think about those perspectives, if that's a way to better understand research. And through previous work, I've heard from a number of different community members involved in projects that story is such an important way to learn and to understand things. So we're hoping that these stories will also prove to be a useful way for community members to understand the goals and the findings of the project. We of course want to involve the young people in each of these steps so they really have a hand in guiding this work. And as part of that, likely the elder facilitators of the Youth Steering Committee will be involved in all of this as well to help guide this work. Let's go to the next slide, please. And just a brief synopsis of a digital story, in case that's a new term for some of you here on this call. The digital stories are usually relatively short, about 3 to 5 minutes, although they can be a bit shorter or a bit longer than that. But they're visual narratives. So often a person will write a script and record their voice on that script, and then put their own images and music or some other background noise, if they'd like, over that recorded voice to create a compelling story. And usually the workshops involve a lot of listening, a lot of story development, a lot of working with people one-on-one, supporting them in being able to translate what's in their mind onto a script, and helping them through the technological process as well, about how to record it, what kinds of pictures they might want to choose. But it can be a very personal and very compelling visual piece that is created out of it. Let's go to the next slide. So just an update on our progress for this. So we've spent a lot of time in receiving approval. For those of you that may be familiar with the process of approval in Alaska, you know that it can take some time to do it well. So we've received AAIRB approval to move forward with recruiting the Youth Steering Committee. And just last week, we received approval from all 3 tribal councils, so 1 community in each of the 3 regions. We'd also gone through and received approval from each of the tribal health organizations, so the larger governing body in each of those 3 regions. And so now we're ready to begin recruitment for regular meetings with our Youth Steering Committee. And here there are nominations for elder facilitators to include as well. So we anticipate our digital storytelling workshops will happen in 2022, and we're excited about that. Let's go to the next slide. I think I will turn it back over to Yvonne to close.
Yeah, thank you both for covering those pieces. As you all have heard, and we had discussed as a team prior, any one of these slides could have been the entire 30-minute presentation that we just covered, just the amount of depth that we could have gone into. But we left out a lot of the nuance. I think the pieces that were really incredible, that were a part of, or have been a part of this project and continue to be. And one of those stories that came to mind actually as I was listening was at our second collaborative hub, where we pull everyone around the state together. We had an Alaska Native Indigenous PhD panel, and I had the honor to facilitate that panel, and it included 3 of our internal leadership team members, Jessica Ulrich, Jessica Black, and Charlene Oppuk, all 3 of whom completed their PhDs over the course of the time of this ANCHRR project. And it's not because of the ANCHRR project that they completed their PhDs. They were on their own paths and doing their work, but ANCHRR provided an opportunity for them to be engaged, and in some cases to be supported to deepen in their research experience and capacity while completing their degrees. And to put that into context, we've only graduated something like 120 Alaska Natives with PhDs from any university in the world. So having these 3 as a part of our leadership team, having completed during the course of the project, is pretty significant. With that, this is our final slide, and we'll open it up to questions. A few of the next steps that we have moving forward, we're very much focused on bringing together, because of the pandemic, we haven't been able to do our face-to-face collaborative hub. We're hoping to get one coming up here this next March in 2022. We're really looking more now at publications, and really sharing the story of how we developed, design, and have conducted the project overall, as well as the research study and some of the initial research findings specifically. And we're hoping that some of this can get approved and get out there potentially as soon as later this fall, if not early spring of 2022. And with that, I'll hand it over to see if Jim or Katie have any other final kind of comments before we open it up for Q&A.
Thank you, Yvonne. The only comment I wanted to add is to be sure to acknowledge the funding support of the National Institutes of Mental Health and the National Institutes of Minority Health and Health Disparities that have allowed to conduct this work.
Thank you,
Right.
Jim. I'd like to open it up for questions. If you please unmute yourself and turn on your camera and feel free to speak up, it would be great. So one thing that occurred to me as I was watching this, and first of all, is how very useful it is. It seems to me that the act of doing digital storytelling itself could be an intervention. Jim, this is more your area, and Katie, probably much more your area, but what are you seeing about that? Because it really makes me think that young people looking at their lives, looking at how they're feeling about things and what they choose to express various strengths, etc., it can be quite a healing and important, empowering experience.
Thanks. I think that that's spot on. I know in some of the earliest conversations that I had about this work, most of my work has been focused on really directly benefiting a community that I've been involved with. I'm involved in community-based participatory action research, which is kind of a buzzword, but making sure that the work that I do and the ways that I spend my time are really directly impacting young people. And even though this work is kind of getting at this larger conceptual framework as well, I think you're right that just the act of talking to young people about strengths, what helps to support their wellness, and going back to that strengths-based approach, we're not asking young people to tell us what makes their lives hard. We'll be asking young people to tell us what helps them to grow and to thrive and to feel well and to feel whole, and what about their communities is good. And I do think that that is in itself an intervention as well, to focus on those types of topics.
If I could add, Dottie, I think your question's really important because it really gets down to something that I've observed is really important to all the people participating in ANCHRR, and really poses an important question for those of us who do research is, research is supposed to be a service. So how does research always provide something of direct benefit to the community of concern? And I think your question is a broader question we all really need to consider carefully. Those of us who do research in the Arctic, research with other Indigenous communities, perhaps research with all communities.
This is Rita. Oh, wait a minute. Hang on.
Yeah, you're good.
Okay. So I was gonna follow up on that and say, because some of the other AIAN groups we work with also have an issue with suicide. And I think that the idea that this is digital and it can be out there, and youngsters that are not Alaska youth but are Indigenous can look and say, wow, that's me. I am in that same boat, or, and I also find that with the youngsters that we have come to our NIH programs, that the feelings and the experiences that they certainly aren't going to share as openly with someone like me, they can share through, we had a young student who did a lot of beading, and this is how she expressed herself. And that's how she was able to tell us a little bit more of what was going on in her life. And I think the digital storybook idea, wow, that's fantastic. Because then with their permission, it can maybe get out there and help other youth. and educate those of us who are not necessarily in a minority group to understand different perspectives. I think that's fantastic, guys. I really do.
Yeah, I just a quick response. I just dropped into the chat a link to our ANCHRR Collaborative Hub keynotes from our first Collaborative Hub. And absolutely, I think a lot of the way we conduct research, I like to use applied research because we're actually applying interventions as we're conducting the research project itself, as was just alluded to by Dottie with the digital storytelling project. But also, if you look at the two young men who were keynotes at that conference and the link I just sent, they both come from an LGBTQ background and really talk about their experiences coming from that lens of experience, and in a way that I think could really help other Indigenous youth within their communities who may also be coming from that same background. And so anyway, so I think we've been pretty intentional, not shying away from the edges of really what could be considered in some cases, challenging or complex topics or areas to focus on. Another of them being Indigenous spirituality. And so that's one of the we've spent a lot of time in conversation with communities and others talking about how do we really speak to that and elevate it in a way that in particular helps other Indigenous people and young people feel safe and okay about talking about those things that are sometimes might be considered taboo within a community context, but maybe a key to them helping to feel better about who they are and what they're experiencing as an individual.
Also, to speak to that just a little bit, one of the interesting things that I found in a different research project I was a part of, where we created digital stories on experiences with cancer, which granted is quite different than suicide prevention, but also one of those issues that I feel like are often not talked about because of its stigma. Is that even when we had digital stories and people didn't have kind of the cathartic in-person experience, but were left on their own in front of a computer watching a story, that they felt like that was a way to develop a relationship and develop a connection with somebody. So I do think that you're right, that there's the potential for digital stories to be a way to connect with other people, even across distance and across time, even if you're not in the same space with them.
Roberta?
Thanks, Dottie. No, I'm really excited about that digital storytelling component that's been added to the project. And I want to build off Rita's comment about ways in which non-Alaskan Indigenous communities could benefit potentially from the outcomes and the research findings. The whole digital storytelling activity reminds me of a project that was conducted under the Finnish Arctic Council chairmanship, Project Creates, that dealt similar types of efforts. There were 3 regional workshops across the Arctic, and building a small library of stories, of narratives of Indigenous youth across the Arctic. I'm just curious to know if there are any thoughts about expanding outreach, dissemination across the Arctic, at a later stages of the project.
Vaughn, Jim?
Yeah, sorry, I'm at home navigating a few things. And so I think I caught the question. So yes, I believe that the outcomes of the research study itself and kind of the not only a supplemental on the youth digital storytelling, but also other elements that are coming out and emerging from our collaborative hub process. I think that they will have applicability outside the Alaska Native context, because there are so many similarities of a history of colonization and assimilation and implications related to self-governance and the other kind of protective community scale that we're developing out of our specific AIM 1 findings. So I think that there'll be outcomes that will be valuable to Indigenous communities, certainly in North America and maybe more broadly than that as well.
Yeah, if I could just add, Yvonne, you were very involved in setting this up, but it's not just the research findings, but also the framework and the process and the way of doing the research. And it's focused explicitly on strengths and culture in community. And for example, Greenland was very interesting. We had a Zoom meeting with representatives from Greenland and researchers in Denmark about how this process and approach could be applied to their suicide prevention efforts. So I think it's really useful to look at this as a package, not just the research findings, but these research findings, of course, always particularized to context and how can a process arrive at and shine spotlight on those elements of context that are unique to every Arctic setting.
Yeah, research methods, absolutely. I think this has come up as a question to me pretty regularly recently from researchers or other people in agencies asking, like, what is the process that they should be following to conduct ethical research within and with Indigenous communities? And I think that we'll be able to share kind of the model and the approach, some of which you saw in one of Katie's slides of getting that Alaska area, the Regional Health Corporation, and then also the Tribal Council approval, because we're wanting to make sure we're really adhering to the highest ethics in the way that we're conducting and moving forward with the research, which means taking the time to take all of those steps. And in some cases, we've had to go and meet in person with the Tribal Council and make a presentation to them and respond to questions. And again, this is really so that we're building out those relationships at the community level. For ANCHRR, as I alluded to earlier, we have extensive relationships with a lot of the villages and communities and leaders at a village level. And so we were able to not have to do some of those steps because we had already basically built those relationships over the last several decades. But in communities that are new that we're pulling into research, then we still have to, take those steps in order to make sure that people know who we are. And even if we are Alaska Native, but we come from a different community or a different region, we're just like any other researcher going into somebody else's village or community and really need to adhere to the local tribal protocol and practices.
Thank you both. Just two quick follow-ups. I know we're at the end of the hour. I dropped in the link for the Project Creates. Once you guys, there's an existing network that you can tap into once you're ready to move on to that stage to share with the frameworks and outcomes. And just a note that NSF, National Science Foundation, is working closely with the Greenlandic research community in terms of improving research principles, like was done within the IARPC. And so our Arctic Social Sciences program, for example, has supported a number of different projects that align with the health and well-being, performance elements and objectives of the research plan that this collaboration team helps to put forward. So a lot of conversations can be forthcoming in that area. Thanks.
I agree. And just to build on what you just said, Roberto, the Canadian Institutes of Health has an institute, the Indigenous Peoples Health Research Institute, that's led by Carrie Barasa, who would be very interested. I think that there are a number of not Alaska, but Canadian Indigenous groups that are in the Arctic Circle that are also affected by some of the same issues that our communities are affected by. And that would also be another interesting partnership. Jim, I'm happy to help you and Yvonne and Katie with any kind of connection if that turns to be interesting to you. She's been a very good colleague for the past couple of years, and it would be an exciting collaboration. Well, we are at the end of the hour, in fact, a minute over, and I just can't tell you how much I appreciate your coming and talking with us. It's been a real privilege, and it's been a privilege to work with this project. Roberto, thank you for going to the National Science Foundation. You opened a door for me that I really value. So I appreciate all of you joining us. Thank you. Yvonne, Katie, Jim, and colleagues, thanks for joining. And we'll see you in about a month.